Okay, so picture this. You're about to have surgery. Maybe a hip replacement, maybe something else. But it's not heart surgery. You're probably thinking about the procedure, the recovery. But did you ever think, hey, is my heart actually ready for this?
Hmm.
And that's exactly what we're diving deep into today, thanks to some fantastic material from the London HeartbeatsZ Academy in the UK. We're taking a look at the 2024 AACC guideline for perioperative cardiovascular management. And trust me, this is a lot more interesting than it might sound.
It really is, because even if you're not having heart surgery, any surgery is a strain on your body. And that, of course, includes your heart. And here's the thing, millions of non-cardiac surgeries happen every year. And a surprisingly large number of those patients actually have some kind of underlying heart condition.
So we're not just talking about people with, like, diagnosed heart disease.
Right, exactly. It could be anything from high blood pressure to a previous heart attack that, you've recovered from. And these pre-existing conditions, they can increase the risk of complications during or after surgery. So understanding how to manage those risks is critical.
And that's where these guidelines come in. This isn't just some little pamphlet. It's a huge document put together by a massive team of experts. We're talking cardiologists, anesthesiologists, surgeons, nurses, pharmacists, even patient advocates. They all came together to make this really comprehensive guide for perioperative cardiovascular management.
And you know what I think is really interesting? It's that diverse group of experts, because it means we're getting a truly holistic perspective on patient care. It's not just about the surgery itself. It's about, that whole patient journey, from the initial assessment all the way to recovery.
Okay, so let's unpack this guideline. It's kind of broken down into these sections. So let's just go page by page. Section 1 kind of sets the stage. It talks about epidemiology, complications, and risk assessment. So basically, it's telling us, why should we even care about this?
Right, and it starts by laying out some pretty sobering statistics. Millions of people undergo non-cardiac surgery every year, and a really significant percentage of those folks have pre-existing cardiovascular conditions. And those conditions, they can lead to all sorts of complications.
Yeah.
Everything from heart attacks and strokes to heart rhythm abnormalities and even death.
Wow, so that's a pretty stark reminder that this is serious stuff.
It is, and the risk of those complications is influenced by a whole range of factors, like age, the type of surgery, and of course the patient's individual medical history. So that's why accurately assessing and managing risk is so, so important.
Okay, so that brings us to risk assessment. How do doctors actually figure out how much risk a patient has? Section 2 seems to be all about that.
Well, they use a variety of tools and techniques, starting with a thorough medical history and physical exam. They'll ask about your past medical conditions, any medications you're taking, lifestyle habits, and any symptoms you might be experiencing. And they'll also listen to your heart, check your blood pressure, and look for any other signs of cardiovascular disease.
So it's a pretty comprehensive assessment. But the guidelines also mention something called risk calculators. What are those?
Risk calculators are statistical models. They use various patient characteristics to estimate the likelihood of a major adverse cardiovascular event, or MAC, happening during or after surgery.
Okay, so they're basically algorithms that crunch the numbers and spit out a risk score.
Exactly. And there are a few different calculators that are commonly used. The guidelines specifically mention the Revised Cardiac Risk Index, or RCRI, and a couple of calculators from the American College of Surgeons National Surgical Quality Improvement Program.
So if I'm going in for surgery, my doctor might plug my info into one of these calculators to get a sense of my risk level. That's kind of cool, but also a little scary.
Yeah, it's definitely a powerful tool, but it's important to remember it's just one piece of the puzzle. These calculators aren't perfect. They can't predict the future with 100% certainty.
All right, so my doctor shouldn't just rely on a number from a calculator. They need to use their judgment too, right?
Absolutely. They'll take the calculator's output into consideration, but they'll also factor in all the other information they've gathered, like your physical exam findings, any lab tests that have been done, and their own clinical experience. It's all about getting a comprehensive picture of your individual risk profile.
So it's not just about plugging numbers into a formula. It's about, human expertise too. That's reassuring. Okay, so we've got the risk assessment part down. Now what? Section 3 seems to dive into the tests that doctors might use.
Exactly. Once that initial risk assessment is done, the next step is often to gather more information through various tests. And this is where things can get a little confusing for patients, because there are a lot of different tests out there, and it's not always clear why one test might be chosen over another.
So let's break it down. What are some of the most common tests used in this perioperative setting?
Yeah.
And what do they actually tell us?
Well, one of the most commonly ordered tests is an electrocardiogram, or EKG. It's a simple, non-invasive test that measures the electrical activity of your heart. It can detect a variety of heart problems, including arrhythmias or irregular heartbeats, and signs of previous heart attacks.
Okay, so the EKG gives us a basic picture of how the heart is functioning electrically. What other tests might be ordered? I see echocardiography in this section.
Echocardiography, or echo for short, is another really common test. It uses sound waves to create images of your heart. It's like an ultrasound for your heart. It can show the size and shape of your heart chambers, how well your heart valves are working, and how effectively your heart is pumping blood.
So it's a way to see the structure and function of your heart in real time. That's pretty amazing. But what about the blood vessels that supply the heart? Can we see those too?
Yes, we can. For that, we use a test called coronary computed tomography angiography, or CCTA for short. It's a specialized type of CT scan that gives us detailed pictures of the coronary arteries. It can show us if there are any blockages or narrowing in those arteries, which could increase your risk of a heart attack.
So it's a very targeted way to look for coronary artery disease.
Right.
And speaking of coronary artery disease, what about the tests that everyone thinks of where they thread a catheter up into your heart?
You're talking about coronary angiography. It's considered the gold standard for diagnosing coronary artery disease, but it's more invasive than the other tests we've talked about. It involves inserting a catheter into an artery, usually in your groin or arm, and threading it up to your heart.
So it's not something they do lightly. When would a doctor recommend coronary angiography in the perioperative setting?
Usually they'll reserve it for patients who have a high likelihood of significant coronary artery disease based on their symptoms or other test results. For example, someone who has unstable angina, which is chest pain that occurs unpredictably, might be referred for coronary angiography.
Okay, so it's a very specific test for certain situations. The guidelines also mention exercise stress testing. What's that all about?
Exercise stress testing, also sometimes called a treadmill test, is used to assess how your heart responds to physical exertion. Basically, they hook you up to an EKG and have you walk on a treadmill, gradually increasing the speed and incline, and they monitor your heart rhythm, blood pressure, and any symptoms you experience.
So it's a way to see if your heart can handle the stress of exercise. And why is that important in the perioperative setting?
Because surgery itself is a form of stress on your body. If your heart can't handle the stress of exercise, it might not be able to handle the stress of surgery either.
That makes sense. So it's a way to gauge your heart's overall fitness. Now, in addition to all these tests, Section 4 mentions something called biomarkers. What are those, and why are they important?
Biomarkers are substances in your blood that can indicate damage to your heart or other organs. In the perioperative setting, one of the most important biomarkers is called troponin.
And what does troponin tell us?
Troponin is a protein that's released into the bloodstream when your heart muscle is damaged. Elevated troponin levels can be a sign of a heart attack or other serious heart problems.
So it's a red flag that something might be wrong.
Exactly. And that's why doctors often check troponin levels before and after surgery, especially in patients who are at high risk of cardiac complications.
Okay, so we've got this whole battery of tests and biomarkers to help assess a patient's heart health before surgery. But I'm guessing it's not just about gathering information. It's about using that information to make decisions about their care. Is that where Section 5 comes in?
You got it. Section 5 is all about the clinical decision-making process. It talks about the importance of shared decision-making between the doctor and the patient.
So it's not just the doctor dictating what's going to happen. The patient has a voice too.
Absolutely. The patient's preferences, values, and goals should all be taken into consideration when making decisions about their care.
That's really important. So let's say a patient has been assessed, they've had some tests done, and now the doctor has a pretty good understanding of their cardiovascular risk. What happens next?
Well, there are a few different paths the doctor might take. If the patient's risk is considered low, they might be cleared for surgery without any further interventions.
So it's like a green light, they're good to go.
Exactly. But if the patient's risk is considered moderate or high, the doctor might recommend additional testing or treatments to try to reduce that risk before surgery.
So it's like a yellow light. Proceed with caution and maybe do some fine-tuning first. What kinds of treatments are we talking about here?
It could be anything from adjusting their medications to recommending lifestyle changes like quitting smoking or losing weight. In some cases, they might even recommend a procedure to improve blood flow to the heart, like angioplasty or bypass surgery.
Okay, so there's a whole range of options depending on the individual patient's situation.
Yeah.
And is there like a specific protocol or algorithm that doctors follow to make these decisions?
The guidelines don't provide a rigid algorithm, but they do outline a general framework for decision making. It starts with assessing the patient's risk level, then considering the urgency of the surgery, and the potential benefits and risks of various interventions.
So it's a thoughtful and individualized approach. That makes sense. Now, before you move on to the next section, I want to quickly recap what we've covered so far. We've talked about why perioperative cardiovascular management is so important, the different tools and techniques used to assess risk, and the decision-making process that doctors use to guide patient care. I've covered a lot of ground, but we're just getting started.
There's still so much more to explore. And remember, if you're finding all this information fascinating, make sure you subscribe to our channels on Facebook, Instagram, Spotify, and YouTube. That way, you'll never miss a deep dive.
Yes, and a huge thank you to London HeartbeatsZ Academy for providing the material for today's episode. They're doing some amazing work to educate both healthcare professionals and the public about heart health.
Absolutely. Now, let's delve into the next section of the guideline, which focuses on managing specific cardiovascular conditions in the perioperative setting. So imagine you're a doctor and you have a patient with a history of heart disease, and they need surgery. What do? Well, that's what Section 6 is all about. Specific recommendations for managing different heart conditions. And it starts with coronary artery disease, or CAD.
Okay, so we're talking about people who have blockages in the arteries that supply blood to the heart muscle. That sounds pretty serious.
Yeah, it can be, especially in the context of surgery. The guidelines talk about a few different scenarios. For example, if someone has recently had a heart attack or has a very severe blockage in their left main coronary artery, they might need a procedure to open up that blockage before they can safely have their other surgery.
So it's like fixing the plumbing before you do any major renovations. You want to make sure the blood supply to the heart is good.
Exactly. But for people with more stable CAD, the decision about whether to intervene before surgery is more nuanced. It depends on factors like the severity of the blockages, the patient's symptoms, and even the type of surgery they're having.
So it's a very individualized decision-making process. What about hypertension? I know a lot of people have high blood pressure. How does that factor into perioperative management?
Hypertension is definitely a common concern, and the guidelines emphasize the importance of keeping blood pressure under control, both before and after surgery. In general, they recommend continuing any blood pressure medications that the patient is already taking.
So don't just stop your meds because you're having surgery.
Right. Abruptly stopping some blood pressure medications can actually be dangerous. But there are some situations where doctors might consider unresting medications or even delaying surgery to get blood pressure under better control.
Okay, so it's a balancing act. You want to keep blood pressure stable, but you also don't want to delay surgery unnecessarily.
Exactly. And then you have heart failure, which is a whole other set of challenges.
So this is when the heart isn't pumping as effectively as it should be.
Right. And in the perioperative setting, the focus is on optimizing heart failure medications to reduce the risk of complications. The guidelines specifically mention a class of medications called SGLT2 inhibitors, which are newer drugs that have been shown to be very effective for heart failure.
But I'm remembering from earlier in the guideline that there's something tricky about these medications in the perioperative setting.
You're right. It turns out that SGLT2 inhibitors can increase the risk of a condition called metabolic acidosis, especially if someone isn't eating or drinking much, which is often the case before surgery.
So what is metabolic acidosis and why is it a problem?
Metabolic acidosis is basically when your blood becomes too acidic. It can cause all sorts of problems, from nausea and vomiting to confusion and even coma.
Okay, that sounds pretty serious. So what do doctors do about it?
The guidelines recommend temporarily stopping SGLT2 inhibitors a few days before surgery to reduce that risk of metabolic acidosis. Then they can be restarted after surgery, once the patient is eating and drinking normally again.
So it's a temporary pause to minimize risk. That makes sense. Now, what about valve problems? The guidelines mention valvular heart disease.
Right, so this is when one or more of the heart valves aren't working properly. It could be a valve that's too stiff and doesn't open all the way, or it could be a valve that's leaky and lets blood flow backward.
Either way, it sounds like it could interfere with the heart's ability to pump blood effectively.
Exactly. And just like with coronary artery disease, the approach to valvular heart disease in the perioperative setting depends on the severity of the problem and the type of surgery being planned. For some people, they might need to have their valve repaired or replaced before they can have their other surgery.
So again, it's about making sure the heart is in the best possible shape before undergoing the stress of surgery. Okay, moving on. The guidelines also discuss atrial fibrillation, or AFib. That's a heart rhythm problem, right?
Yes. AFib is when the upper chambers of the heart, the atria, quiver instead of beating regularly. It's a very common rhythm problem, especially in older adults.
And I've heard that AFib can increase the risk of stroke.
You're right. When the atria aren't beating effectively, blood can pool in those chambers and form clots. If a clot breaks loose and travels to the brain, it can cause a stroke.
Okay, so how do doctors manage AFib in the perioperative setting?
The main focus is on preventing stroke. They might prescribe blood thinners to reduce the risk of clots, and they might also try to control the heart rate to make sure it's not beating too fast.
So it's all about keeping that heart rhythm as stable and controlled as possible. And what about people who have pacemakers or defibrillators? I'm guessing those devices need special attention too.
You bet. Section 6 also covers the management of pacemakers and implantable cardioverter defibrillators, or ICDs. These devices are basically little computers that monitor the heart rhythm and deliver electrical impulses to keep it beating regularly.
So they're like backup systems for the heart's electrical system.
Exactly. And in the perioperative setting, it's important to make sure these devices are working properly and won't be interfered with by any of the equipment used during surgery.
So what kinds of precautions are taken?
Well, for example, if someone has an ICD, they might need to have it temporarily deactivated during surgery to prevent it from firing inappropriately. And after surgery, they'll need to have it checked to make sure it's still functioning correctly.
So there's a lot of coordination involved between the surgical team and the cardiologist to make sure these devices are managed safely. Now, this next one surprised me. The guidelines even talk about obstructive sleep apnea. I wouldn't have thought a sleep disorder would be that important in the context of surgery.
It might seem surprising, but sleep apnea can actually increase the risk of complications during and after surgery.
How so?
Well, people with sleep apnea repeatedly stop breathing during sleep, which puts a lot of stress on the heart and lungs, and this can make them more vulnerable to problems like heart rhythm disturbances, high blood pressure, and even heart attacks.
Okay, so it's not just about being tired. It's about the physiological stress that sleep apnea puts on the body. So what do they recommend for managing sleep apnea in the perioperative setting?
Well, the first step is identifying patients who might have sleep apnea, and the guidelines actually recommend using a screening questionnaire to assess risk. If someone is at high risk, they might need to undergo a sleep study to confirm the diagnosis.
And once the diagnosis is confirmed, what happens then?
Well, the treatment for sleep apnea often involves using a continuous positive airway pressure, or CPAP, machine. It's a mask that you wear while you sleep, and it delivers a constant stream of air to keep your airway open.
So it's like a little air splint for your airway. And if someone is already using CPAP, do they need to continue it while they're in the hospital?
Absolutely. It's important to continue CPAP therapy throughout the perioperative period to minimize the risk of complications. They might even need to use it during surgery, depending on the type of anesthesia they're having.
Okay, so sleep apnea is definitely not something to be overlooked in the context of surgery. Now, we've covered a lot of different heart conditions. What about medications? Surgery often means tweaking your meds, right?
You're absolutely right. Managing medications in the perioperative setting is a complex but crucial part of patient care. Section 7 of the guidelines is devoted to this very topic. It covers a wide range of medications, including those used for high blood pressure, heart failure, cholesterol, and blood sugar control.
Let's start with statins. Those are the cholesterol-lowering drugs, right?
Yes, statins are one of the most commonly prescribed medications, and they've been shown to reduce the risk of heart attacks and strokes. The guidelines recommend continuing statins in patients who are already taking them, as stopping them abruptly could actually increase the risk of cardiovascular problems.
So if you're on a statin, don't stop it just because you're having surgery. But what about people who aren't already taking a statin? Do they recommend starting one in the perioperative period?
That's a bit of a gray area. The evidence for starting statins right before surgery isn't as strong as the evidence for continuing them in people who are already taking them. So the decision to start a statin in the perioperative setting is more individualized and depends on factors like the patient's overall risk level and the type of surgery they're having.
Okay, so it's not a one-size-fits-all approach. What about other blood pressure medications? We talked about hypertension earlier, but there are a lot of different drugs used to treat it.
Right. And the guidelines address several specific classes of blood pressure medications, including ACE inhibitors, ARBs, and beta blockers.
Let's tackle those one by one. What are ACE inhibitors and ARBs?
They're both types of medications that work by blocking a hormone system in the body that's involved in regulating blood pressure. They're very effective for lowering blood pressure and also protecting the kidneys.
So they're important medications for people with hypertension. What do the guidelines say about managing them in the perioperative setting?
The general recommendation is to continue these medications in patients who are already taking them. However, they do acknowledge that there's a risk of these medications causing low blood pressure during and after surgery, especially if someone is dehydrated or losing blood.
Okay, so it's a balancing act. You want to keep blood pressure under control, but you also don't want it to drop too low.
Exactly. And that's why they recommend careful monitoring of blood pressure in patients taking these medications and adjusting the doses or temporarily stopping them if
Okay,
necessary.
that makes sense. Now, what about beta blockers? Those are another common type of blood pressure medication, right?
They are. Beta blockers work by blocking the effects of adrenaline on the heart. This slows the heart rate and lowers blood pressure.
So they're calming the heart down. And what do the guidelines say about beta blockers in the perioperative setting?
They recommend continuing beta blockers in patients who are already taking them for certain heart conditions, like heart failure or a previous heart attack. However, they don't recommend routinely starting beta blockers in the perioperative period for people who aren't already taking them.
Interesting. So it's about maintaining stability rather than introducing a new medication right before surgery.
Exactly. Now, moving on to blood sugar control. The guidelines have a whole section devoted to diabetes management in the perioperative setting.
That makes sense. I know that diabetes can increase the risk of complications from surgery.
You're right. High blood sugar can impair wound healing, increase the risk of infections, and even affect heart function. So it's important to keep blood sugar levels under control, both before and after surgery.
So how do they do that?
Well, it depends on the type of diabetes the patient has and how well their blood sugar is usually controlled. For people with type 1 diabetes who require insulin injections, they might need to adjust their insulin doses or switch to an insulin pump in the perioperative period.
So, more frequent adjustments to keep those blood sugar levels in check. What about people with type 2 diabetes?
For them, it's often about coordinating with their endocrinologist to make sure their medications are adjusted appropriately before and after surgery. They might also need to monitor their blood sugar more frequently during this time.
So a lot of communication and collaboration to make sure those blood sugar levels stay stable. Now, we've talked about medications for heart disease, blood pressure, and diabetes. Are there any other medications that need special consideration in the perioperative setting?
Yeah, the guidelines also address antiplatelet medications and anticoagulants.
Okay, so those are the medications that prevent blood clots.
Exactly. Antiplatelet medications like aspirin and clopidogrel prevent platelets from sticking together and forming clots. Anticoagulants like warfarin and the newer DOACs work by interfering with the clotting cascade in the blood.
So they're both important for preventing clots, but they work in different ways.
Right. And the decision about whether to continue or stop these medications before surgery depends on a lot of factors, including the patient's risk of bleeding versus their risk of clotting, the type of surgery they're having, and whether there are alternative strategies for clot prevention.
So it's a very individualized decision-making process that involves weighing the risks and benefits. And it sounds like it requires close communication between the surgeon, the cardiologist, and the patient.
Absolutely. It's a team effort to ensure the best possible outcome for the patient.
Okay, so we've covered a lot of ground on medications. But before we move on, I want to circle back to something you mentioned earlier, the risk of low blood pressure during and after surgery. Is that a common problem?
It can be, especially in people who are older, have underlying heart conditions, or are taking certain medications.
And why is low blood pressure a problem?
Well, when your blood pressure drops too low, it means your organs aren't getting enough blood flow, and that can lead to all sorts of problems, from dizziness and confusion to kidney damage and even heart attack.
Okay, that sounds pretty serious. So what do they do to prevent and manage low blood pressure in the perioperative setting?
The guidelines recommend careful monitoring of blood pressure throughout the perioperative period, and they suggest a few strategies for preventing and treating hypotension. One strategy is intravenous fluid administration, which can help increase blood volume and boost blood pressure.
So it's like giving the circulatory system a little boost.
Exactly. Another strategy is to adjust or temporarily stop any medications that might be contributing to the low blood pressure, like diuretics or certain blood pressure medications.
So it's about finding the right balance of medications and fluids to keep blood pressure in a safe range. Now, we've talked a lot about the medical aspects of perioperative care, but I'm guessing there's also a psychological component to all of this. Surgery can be stressful, and that stress can definitely affect the heart.
You're absolutely right. Section 8 of the guidelines is devoted to psychosocial considerations. It talks about the importance of addressing anxiety and depression in patients who are undergoing surgery.
So it's not just about fixing the physical body, it's about taking care of the mind as well.
Exactly. And there are a few different ways to approach this. Some patients might benefit from counseling or therapy to help them cope with the stress of surgery. Others might find relaxation techniques like deep breathing or meditation to be helpful.
So it's about giving patients tools to manage their stress and anxiety. And are there any specific recommendations for how healthcare providers can support patients emotionally during this time?
The guidelines emphasize the importance of clear communication, empathy, and active listening. Patients need to feel heard and understood, and they need to be reassured that their concerns are being taken seriously.
So it's about creating a supportive and compassionate environment. Now, speaking of the environment, let's move on to Section 9, which focuses on the systems of care involved in perioperative cardiovascular management.
This section highlights the importance of having well-coordinated systems in place to ensure that patients receive the best possible care. It talks about things like clear communication pathways between different healthcare providers, timely access to specialists, and standardized protocols for managing various conditions.
So it's about making sure everyone is on the same page and working together seamlessly.
Exactly. And this section also emphasizes the role of nurses in perioperative care. Nurses are often the ones who are most closely involved with patients throughout their hospital stay, and they play a critical role in monitoring their vital signs, administering medications, and providing emotional support.
So they're the eyes and ears on the ground, making sure everything is running smoothly. And are there any specific recommendations for how hospitals can improve their systems of care for perioperative cardiovascular management?
The guidelines suggest a few things, like implementing multidisciplinary care teams that include cardiologists, anesthesiologists, surgeons, and nurses. They also recommend developing standardized protocols for managing common conditions, like hypertension and diabetes. And they emphasize the importance of data collection and analysis to track outcomes and identify areas for improvement.
So it's about using a systematic approach to optimize care. Now, we've covered a lot of information in this deep dive, but I know there's one more section to go.
Yeah, Section 10 is a bit different from the others. It focuses on future directions for research and knowledge gaps that still need to be addressed.
So it's like a roadmap for where the field needs to go next.
Exactly. And one of the key themes in this section is the need for more individualized approaches to perioperative cardiovascular management. Right now, a lot of the recommendations are based on large population studies, but every patient is unique, and we need to get better at tailoring care to their individual needs and risk factors.
That makes sense. It's like moving from a one-size-fits-all approach to a more bespoke approach.
Exactly. And this section also highlights the need for more research on specific topics, like the optimal management of certain medications in the perioperative period and the long-term effects of myocardial injury after non-cardiac surgery.
So there's still a lot to learn. But even with these knowledge gaps, these guidelines represent a huge step forward in improving the care of patients with heart conditions who are undergoing surgery.
They really do, and they're a testament to the power of collaboration and evidence-based medicine by bringing together experts from different disciplines. And using the best available scientific evidence, we can continue to advance the field and improve outcomes for our patients.
Absolutely. And I think that's a perfect note to end on. Remember, if you're interested in learning more about heart health, make sure you subscribe to our channels on Facebook, Instagram, Spotify, and YouTube. We're always diving deep into fascinating topics like this one.
And a huge thank you once again to London HeartbeatsZ Academy for providing us with these cutting-edge guidelines. Their dedication to education and knowledge sharing is truly making a difference in the lives of patients around the world.
So we've spent a lot of time talking about what doctors and hospitals can do to manage cardiovascular risk in the perioperative setting. But what about, you as a patient?
That's a great question, because while these guidelines are mainly aimed at healthcare professionals, there's a lot that patients can take away from them too.
Like what?
Well, first and foremost, I think it's really empowering to understand the complexity of perioperative care. It's not just about the surgery itself, it's about this whole journey that you go on.
Yeah.
And your heart health is a crucial part of that journey.
So it's not something to be taken lightly.
Exactly. And if you have any underlying heart conditions, it's so important to work closely with your doctor to manage those conditions effectively. That might involve medications, lifestyle changes, or regular checkups.
All right, so it's about being proactive and
Yeah.
taking ownership of your heart health. And if you're facing surgery, don't be afraid to ask your doctor questions about how they're going to manage your cardiovascular risk.
Absolutely. It's your health. And you have a right to be informed and involved in your care.
Yeah, and one thing that really struck me from these guidelines is that the field is constantly evolving. There's so much research going on, and new discoveries are being made all the time.
It's true, these guidelines are kind of a snapshot in time, but they'll continue to be updated as new evidence emerges, so it's important to stay informed and keep up with the latest advances.
So stay curious and keep those hearts healthy. And a huge thank you again to London HeartbeatsZ Academy for providing the material for today's episode.
Their commitment to education and knowledge sharing is truly commendable.
And to all our listeners, don't miss out on future deep dives like this one. You can find us on Facebook, Instagram, Spotify, and YouTube for more insightful discussions on all things health and medicine. We love exploring these complex topics with you and empowering you to take charge of your well-being. Until next time, stay curious and keep those hearts beating strong.